Have you ever been sleeping soundly when you suddenly woke up startled by a sharp pain in your calf, so painful that you could only clutch your leg and gasp for air? Why can these seemingly small cramps turn a peaceful night into a nightmare? Imagine waking up every morning with strong, steady, and energized legs. If you want to stay active, independent, and confident, the secret lies in nutrition. Stay with us, because the answer is right here in this video. We will reveal to you the top 5 most important vitamins that help strengthen your legs, keep your muscles flexible, and prevent the risk of cramps. I am the nutrition expert from Health Tips 365, always ready to accompany you. Please leave a comment below and feel free to ask any questions you have. Don't forget to hit the subscribe button and turn on notifications so you never miss the best health tips from Health Tips 365. We have just opened the first door together in the journey of taking care of your legs. Now I invite you to continue with me, gently but firmly, as we explore 5 silent yet extremely important friends that help us defeat those troublesome leg cramps. 1. Calcium. Calcium not only helps strengthen bones, but also plays a fundamental role in muscle contraction and relaxation. As we age, bone density naturally decreases, causing the amount of calcium stored in the body to gradually decrease. This is the underlying cause that makes you more susceptible to cramps, especially at night. Calcium is the main mineral that makes up the bone structure, helping bones withstand force and maintain a stable shape. If there is a lack of calcium, not only will the bones weaken, but the muscles will also become prone to abnormal contractions. The mechanism of muscle contraction depends heavily on the movement of calcium ions in the cells. When there is not enough calcium, the muscles are easily overstimulated, leading to painful contractions. Studies have shown that people with low blood calcium levels are more likely to experience night cramps than normal people. In addition, long-term calcium loss also leads to osteoporosis and bone fractures, directly affecting mobility. Therefore, supplementing enough calcium every day not only prevents cramps, but also keeps your legs steady over time. Calcium is abundant in milk, cheese, spinach, sardines with bones, almonds, and beans. You should diversify your food sources so that your body can absorb natural calcium better. In particular, for calcium to be effectively absorbed into the bones, it is necessary to have the support of vitamin D, magnesium, and vitamin K2. For the elderly, the daily calcium requirement ranges from 1,000 milligrams to 1,200 milligrams, depending on physical condition and general health. However, calcium supplementation must be done carefully. If overused, excess calcium can cause deposits in the kidneys or blood vessels, leading to kidney stones or atherosclerosis. Natural calcium absorption will be most effective when combined with vitamin D, so the best time to supplement calcium is in the morning after eating or at noon. Avoid taking calcium in the evening because it can cause calcium deposits in the kidneys. Recommended calcium-rich foods include salmon and spinach porridge, yogurt with almonds, seaweed soup with shrimp, or simply a glass of warm milk after breakfast. Light exercises such as morning walks, tai chi, yoga to stretch the legs, or standing up and sitting down slowly also help stimulate bones to absorb calcium better. A balanced diet and regular exercise are the keys to keeping your legs strong and healthy for a long time. This vitamin plays a fundamental role in maintaining healthy, balanced, and functional legs. Let's take a closer look at why vitamin D is the most important nutrient for leg strength in older adults, and how ensuring adequate vitamin D intake can transform mobility and overall health. Vitamin D acts as a bridge, helping calcium to be absorbed into the bones and maintaining muscle strength. Without vitamin D, the body cannot use calcium effectively, leading to weak bones and muscle spasms. Vitamin D is essentially a special hormone produced through the skin when exposed to natural sunlight. Vitamin D, a silent but extremely important friend for foot health. Vitamin D helps the body absorb calcium effectively, keeping bones strong and muscles flexible. As we age, our skin becomes weaker, and the ability to synthesize vitamin D from sunlight is also significantly reduced. You can imagine, if lacking vitamin D, muscles are like machines lacking oil, working slowly and easily malfunctioning. Therefore, every morning before 9 a.m. or late afternoon after 4 p.m., You should try to go out to sunbathe gently for 15 to 30 minutes. In addition to sunlight, we can also supplement vitamin D through foods such as salmon, sardines, egg yolks, mushrooms, or drink milk fortified with vitamin D. If sun exposure and diet are not enough, your doctor may advise you to take vitamin D tablets with a common dose of about 800 to 1,000 IU per day. In addition, light exercises such as walking slowly outdoors, practicing Tai Chi, and light yoga will help your body synthesize and absorb vitamin D more effectively, making your legs more flexible and healthy. 3. Vitamin B12. Vitamin B12 plays an extremely important role in maintaining nerve function and transmitting motor signals. Vitamin B12 deficiency causes the nerves to weaken, muscles to lose control, and lead to cramps. The nature of vitamin B12 is to support the formation of the myelin layer that protects the nerves, ensuring that signals from the brain to the legs are transmitted quickly and accurately. Many studies show that people with B12 deficiency often experience numbness in the limbs and reduced balance. The ideal time to supplement B12 is in the morning during or right after meals for the body to absorb best. Easy-to-prepare B12-rich dishes include boiled eggs, pan-fried salmon, soft beef stew, or a cup of yogurt fortified with vitamin B12. In addition, maintaining the habit of walking lightly for 15 to 20 minutes after eating will help blood circulation better, supporting the process of transporting B12 to the muscles. Don't forget, a diet full of B12 every day is a priceless gift to help you keep your legs healthy and strong over time. 4. Magnesium. Magnesium is an important mineral that helps muscles contract and relax smoothly, effectively preventing cramps. When magnesium is deficient, people are prone to muscle spasms and pain, especially at night. Magnesium helps calm overactive nerve signals and prevent sudden muscle spasms, making it essential for people who struggle with muscle tension and involuntary contractions. While calcium is often focused on bone health, it cannot perform its function effectively without magnesium. Studies have found that higher magnesium intake is associated with bone strength and a reduced risk of fractures in older adults, making magnesium an essential component of overall mobility. Many older adults take medications that decrease magnesium levels, including diuretics, proton pump inhibitors, and some blood pressure medications. Combined with a diet low in magnesium-rich foods, the result is a widespread deficiency that silently undermines strength, endurance, and flexibility. This is why many older adults experience a gradual loss of stamina, walk shorter distances, climb stairs more slowly, and feel tired after simple activities. Replenishing magnesium levels can have an almost immediate effect on leg health, reducing cramps, improving energy, and restoring a sense of ease in movement. The best dietary sources of magnesium include green leafy vegetables, nuts, seeds, whole grains, and legumes. 5. Potassium. Imagine waking up in the morning, getting out of bed, and immediately feeling a cramp in your calf. Sound familiar? Muscle cramps are one of the most common symptoms of low potassium levels. This is because potassium acts as a key regulator of muscle function, helping to balance fluids inside and outside muscle cells. Potassium helps neutralize acids in the body that can break down bone density over time. Studies show that a diet rich in potassium can slow the rate of bone loss, reduce the risk of osteoporosis, and keep your legs structurally strong. So in many ways, potassium doesn't do justice to muscle function. It's involved in making sure that both the muscles and bones in your legs work in harmony. Now, the big question is, how do you make sure you're getting enough potassium to support your legs? Luckily, nature has provided us with a wealth of delicious potassium-rich foods. Bananas may be the first thing that comes to mind, but they're just the start. Sweet potatoes, avocados, spinach, beans, and oranges are all great sources of potassium. How much potassium do you really need? The recommended daily intake for adults is 2,600 milligrams for women and 3,400 milligrams for men. This is usually achieved through a balanced diet rich in fruits, vegetables, and legumes. However, people with health conditions that affect potassium levels, such as kidney disease or high blood pressure, should monitor their potassium intake carefully and work with their doctor to determine the right amount. With just these 5 simple but valuable vitamins and minerals, we can completely maintain the health and flexibility of our feet. Every nutritious meal, every sunny morning, every slow step is a gift of health that you are giving yourself. Maintaining the supplementation of vitamins D, calcium, B12, magnesium, and potassium not only helps reduce cramps, but also helps your feet become more stable, helping you to confidently live and enjoy life every day. If you find this video useful, please click like to support us. And don't forget to leave a comment sharing your feelings or questions so I can give you more advice. Please click the subscribe button to the Health Tips 365 channel and turn on the notification bell so that every day we can take a step closer to a healthy life full of love and energy. Wishing you peace, health, and steady feet on every journey of life.